Let me know if anything makes you feel uncomfortable, okay?
Yes, ma'am.
All right, Mr. Cray.
Reverend Cray, actually.
Okay, Reverend. How old is Lindsay?
14. Now, how long was this going to take? And I'm only asking that because we got to get down to Cedar Rapids. I'm preaching at a revival meeting tomorrow.
Okay, we'll just figure out what's going on here first and take it from there.
Have you ever felt pain like this before?
Her last pregnancy, she'd get sick like this, but not with all this blood.
Last pregnancy?
Lindsay, what happened with your last pregnancy? Did you carry to term?
She'd had what they called a spontaneous miscarriage. That was 4 months ago.
Well, it doesn't look like she's pregnant now. However, I am seeing some irregularities in the lining of her uterus. Perhaps something that didn't move through when she had her miscarriage. All right, I'm gonna do a pelvic exam now. Are you all right with that?
You can come outside. There's a waiting area. We'll give your daughter a little more privacy.
My daughter? Lindsay's my wife.
This marriage is legal? That guy and a 14-year-old girl?
Her father gave us consent, and a judge signed off on it, so yeah.
What about her mother?
Now, she died when Lindsay was only 3.
That man should be arrested.
Right, but on what charges?
Rape, coercion, whatever. This girl is a kid. She obviously had no choice in the matter.
He barely lets her speak. Can we call in the police? Family services?
Well, unfortunately, we're required to respect Michigan state law.
How's the girl doing?
She's undergoing a DNC to get rid of any products from her prior miscarriage.
Yeah, which the Reverend only okayed because he wants Lindsay to be able to conceive as soon as possible.
I realize this is distasteful for all of us, but I implore both of you to do your best not to let your personal feelings interfere with the care of this patient or the law.
Hi. How are you feeling, Lindsay?
I'm a little groggy still, but I feel better. Thank you, ma'am.
Is everything okay with her?
Well, that's what I came in to discuss with you both. The gynecologist found a tumor growing within the tissue that would have become the placenta.
Tumor?
Yes. She sent it to pathology. It is, I'm afraid, malignant. It's called a choriocarcinoma.
I have cancer?
Thankfully, it's still confined to your uterus. That's what's called stage 1. Given that we caught it relatively early, these tumors generally respond favorably to chemotherapy.
And if that doesn't work, what happens then?
Worst case scenario, we would need to consider a hysterectomy, but we are far, far from even discussing that.
See, first she comes in here, talks chemo. Next, she's scheming to remove your womb altogether.
I can assure you there is no scheming going on.
Chemo can lead to infertility.
Not necessarily. Yes, there are some risk factors, but to do nothing at all would be far, far riskier.
No, thank you, then. We will not be doing any chemotherapy.
Sir, I'm going to ask you to step out for a moment so that I can discuss this with my patient privately.
Why? She doesn't want me to leave. Go on, ask her.
He can stay.
Like I said, only thing we need from you now, doctor, is to get Lindsay discharged.
I'm not sure I should be talking to you alone.
Is that what he told you? Listen, I'm not sure how you feel about being married, but the one advantage that it does give you is that you are considered by law to be medically emancipated.
Emancipated?
It means you have the right to make your own medical decisions.
Does chemo really make it so I can't have a baby?
No, and Lindsay, it's clearly your best and safest bet in moving forward.
What are you doing?
Nothing.
I was just conferring with my patient. Lindsay, regardless of what this man thinks or wants, it is your body and your choice. So what do you want to do? Sir, get your hands
From
off
the
of
start,
me.
you have been willful and argumentative.
My patient has the right to decide how she wants to treat her cancer.
Cancer is you. You've been treating Lindsay like she's a child,
She
not a woman.
is a child. She's 14.
Just because you had some judge sign off on what's obviously a case of
I need to
abuse
talk to
does not
somebody in charge
magically
here.
decree her a woman. And now you want to play games with her health? You are a bully and a predator.
I'm the charge nurse, sir. How can I help you?
Yes, I want this bitch removed from my wife's care.
You're absolutely right. And again, I want to apologize for Dr. Manning's behavior. It was entirely unprofessional.
Very aggressive, it was pushy.
Well, between you and me, this is not the first time we've had a problem with her. She can get emotional. Women, right? I have to check up on a patient in orthopedics. Monique, help Reverend Cray here with discharge paperwork, would you? Patient's name is Lindsay Cray. Monique will take great care of you. Good luck and God bless, Reverend. I will be praying for you and your wife.
Thank you.
You're very welcome.
Where's the Reverend?
He's filling out the paperwork needed to take you out of here. I can't keep you here much longer. I know you have some big decisions to make, but I won't be able to get you the medical attention you need unless you speak up right now.
My mother died when she was 19. She had ovarian cancer. My great-grandmother, too. Guess it's the family curse.
I'm sorry to hear that.
The lady doctor said something earlier about a hysterectomy.
Dr. Manning, yes. Now that is only if you get sicker. With the right medicine, you have a great chance of beating this. You can live a long life, have a family someday.
Are those things I'm supposed to look forward to? No, I want a hysterectomy.
A hysterectomy is really not necessary at this point.
I don't care. Some women have their breasts removed if they have the cancer gene just so they don't get it later, right?
But you are so young. A hysterectomy is irreversible. You will not be able to become pregnant and have children, ever.
You don't know my life. You don't understand. I don't want to bring a kid into this world. Dr. Manning said it was my decision.
What is going on here?
Lindsay has decided to have a hysterectomy.
Over my dead body. She is my wife. I make the decisions.
Sir, please move.
You lay so much as a finger on her, and I will sue you to kingdom come.
We have her consent.
You lied to me. She can't make that kind of decision for herself. She was obviously coerced. He forced you to sign this, didn't he?
No. It was my decision.
You have 2 seconds to step aside, Mr. Cray, or I will have you forcibly removed from the premises.
You go through this, Lindsay, and you will be banished by the church, the community, everything. You will be diminished in the eyes of the Lord. Do you understand?